Are you experiencing pain around your chest region? Do you experience every time headache? That's chronic headache. Do you experience shortness of breath? Or do you experience bleeding on your nose? This could be the signs that you have elevated blood pressure. Who knows? So today, I want to speak on this very vital topic called hypertension. Hypertension. Yeah, because it has caused more damage in the society than good, especially in this our current generation. So, high BP. Okay, let me quickly explain what's BP. BP is just the pressure at which your heart pumps blood through your body to all your body, all the parts of your body. So it's the function of the heart to pump blood. So there is a very pressure that it is supposed to be pumping blood. Yeah. So that is just BP. Then what is now high BP? High BP simply means that the pressure at which it now pumps blood is now at increased rate. And what can actually make it increase? The rate to increase. Number one is when there is much more amount of blood, too much amount of blood to pump, or maybe there is an obstruction in the artery that the blood is meant to pass through. There is obstruction. Something is obstructing it, the free flow of blood to all parts of your body. So what then happens in turn? The heart exerts more pressure and more pressure and more pressure in trying to pump that blood. That is high blood pressure. Then next thing is what actually causes what are the symptoms? What is that those things that you'll be experiencing when you now that you when you see you now say that you have high BP. From studies and research, that is, it has no signs and symptoms until you go and run a health checkup. Even it can be at a very high side and still you won't be experiencing any signs and symptoms until it now reaches maybe a life-threatening stage. But yeah, we know that there are some things that when you noticing, we know that there are some things when you'll be doing, you notice, you can say this actually it can actually be high BP. Something like when you maybe when you're normal walking, when you walk a little distance, you'll be having like breathing fast. You understand? Gasping for breath, shortness of breath. That's what I said earlier. Then next one is when you're experiencing headache, every time you're experiencing headache. Then next one is sometimes you have bleeding in your nose, and then you may also be experiencing pain around your chest region. That is angina pectoris. Okay, these are many more. So now, what causes this high BP? What causes this high BP? There are so many. It has many causes. It can be caused by congenital. I think congenital is a defect in your blood vessel, according to how you are born. So it comes from family history. Then another one is alcohol. When you consume too much of alcohol abuse, you're always taking alcohol. Then next one is when you have kidney problem. If you have kidney problem, it can also cause high blood pressure. Then there are some certain medications, especially medications that are maybe some medications that something like birth control pills. All these medications can cause high BP. You understand? There are also some risk factors that can actually contribute in causing this high BP. Something like your age. Of course, high BP is more common in men that have reached the age of from 45 years and above. Yeah, and then for female women that have reached the age of is 65 and above. So, but in this we all know that in this our current generation that even women tend to even have high BP more due to the next uh, risk factor I'm going to tell you, which is what? Obesity and inactivity. Obesity and inactivity. Um, Obesity is when you have too much fatty tissues, when you're overweight. People have told me I go to, I always weigh myself, and it's not about going to weigh yourself. What's your BMI? What's your body mass index? Body mass index is your weight over your weight over your height squared. That's how you calculate it. So that you know your whether you are still in in your normal weight category, or you are now overweight, or whether you're obese. I think obesity is, I think, from 35 and above. That's when you know that you are obese. So, and what actually, the easiest thing that causes this obesity is uh, when we are inactive. You are inactive, you don't exercise your body, you don't exercise your body. So before you know it, you're obese. You eat late night food. So even women now tend to even suffer from high BP more than even the men. All right. So the next one is when you consume too much of salt. Too much of salt can elevate your blood pressure, and then your tobacco. When you tobacco use, you understand, it causes it restricts the flow of blood in your veins. Yeah, it restricts the free flow of blood in your vessels, and then of course causes damage in the blood vessels. So these are many more are the causes of high BP. Then, of course, what can it now result to? The complications, it can result in you having heart attack. Yeah, heart attack. And before, of course, before you have that attack, it means we're giving you signs and symptoms. But when we talk with us is that we always we neglect some signs and symptoms when it comes. There cannot be heart attack until it means we're giving you sign. So you're having chest pain around your chest region, and angina. So before you know it, can lead to heart attack, and it can lead to heart failure too. Heart failure. Heart attack is a situation whereby um, probably you have high cholesterol, bad cholesterol, the low density lipoprotein, LDL. You have too much of it, and then the cholesterol crystals go to deposit in your blood vessels, thereby narrowing the arteries. So there is no much free flow of blood through the arteries. So that's when, before you know it, there is too much deposit, and then before you know it, it ruptures and can cause heart failure. Okay, and we all know that if it occurs at the arteries that pump blood to your brain, then that's when you now experience what is called stroke. Stroke. So that is one of the complications, and then second complication is what we call aneurysm. Aneurysm is weakness. When we are is weakness in your blood vessel, it can bulge. You understand? It can bulge, and when the bulge ruptures, it can cause instant death. Probably in my next video, I'm going to continue from there. Of course, in my next video also, I'll show you how to run your personal test on high BP to know that you are hypertensive. Yes, I'm going to teach you for free. Yes, I'm going to teach you for free in my next video. So if you are yet to uh, subscribe, please subscribe in my page, in my YouTube page, as you see on the screen. Then, if you are yet to follow me in my Facebook page, please follow me in my Facebook page as seen on the screen. Yes. So, in our company, we have some, of course, we have solution to every problem, any of your problem as regards to chronic diseases. So, depending on what caused your uh, what caused your high elevated blood pressure. If it's caused by stress, then we'll start by giving you stress reducing medication, stress relieving medication. If it's caused by obesity, then we start by giving you um, fat burning products that will help you burn off fats and lose weight. Then you can take a look at this package as seen on the screen. Yes, that package you see on the screen. That's our whole package for a hypertensive patient. If you find this video educative and useful to you, please kindly click on the like button, comment, share, and of course, follow me. See you in my next video. I see my humble self. That's your favorite nutritionist, Anthony Somtochukwu Onwuka. Bye.